Hi, everyone. Welcome to our presentation today. My name is Dr. Heather Quayle. I'm a women's health nurse practitioner, as well as one of the NPWH Board of Directors. Thank you so much for attending this. And my background is a women's health nurse practitioner with the Sexual Health Optimization and Wellness Center, or also known as the SHOW Center. I am the CEO and founder, and I work a lot in sexual dysfunction. I also am a women's health advocate, as well as a nurse practitioner in a sex trafficking center that I founded through a Georgia governor with a lot of grant funding here in Georgia. And I like to call that my passion work. I spent quite a bit of time working in healthcare policy as well. And so I thought it was just very appropriate to do this lecture with just one of my most favorite people in the world. So I am going to pass everything over to Dr. Fedino, and she will introduce herself, and then we will get started on this very important topic.
Thank you, Dr. Quayle. I'm Dr. Rachel Fedino, and I'm also a women's health nurse practitioner. I'm on the board of directors for NPWH as well, and I'm also a CEO of my own medical practice in Washington State. And so Heather and I have been working together for several years, and we have a passion towards healthcare policy, and we wanted to really bring this to practice with you guys at the conference this year. So without further ado, we're going to get started. As far as learning objectives, we're going to be discussing the importance of NPs being politically engaged in key healthcare issues affecting women, the profession, and our communities. We're also going to be discussing how to really provide clinical expertise and educational background with passing legislation as a nurse practitioner. Dr. Quayle and I have no disclosures. We really wanted to kick off this presentation with a quote from Alice Walker. And, one of the most common ways that people give up their power is by thinking that they don't have any. And I think as nurse practitioners, we come from a nursing background. And so potentially our voice may be a little bit more submissive. The medical community with, doctors and physicians potentially can dominate that in our voice. And so I think that as nurse practitioners and the nursing community really starts raising awareness about certain health issues, I really do think that we're going to feel more powerful in the healthcare legislation world.
So I think it's really important to kind of tie into what Dr. Fedino said. A lot of times we do kind of feel like we're powerless. And I think it comes from a place of, oh, you're just a nurse, or, oh, you're just a nurse practitioner. And we don't think about us actually being a force behind all the things that we really do. And we really are the experts. So I really like to kind of bring this presentation back to the very first nurse, which was our Florence Nightingale. I think she really, really is the perfect political figure when we think about the world of nursing and political action. And what political activism is it's a very powerful form of professional involvement. And we're going to kind of bring in a lot of this in this lecture today. But when we think about Florence Nightingale, it's really important to realize she really was our first nurse, but she was also kind of our first nursing politician, because she really understood how to influence the British Parliament. She was able to make changes in the hospital. She was able to make changes for our patients and really able to improve healthcare. And so I really like to start out this lecture by kind of just showing where she was in this atmosphere and how we can utilize her as a role model. Next slide, please. So I think before we even go any further, it's really important to establish what is a policy. And a policy is a deliberate system of principles to guide decision-making and to achieve outcomes. They can be achieved either in a subjective manner or an objective manner. And it's a statement of intent, something such as a procedure and a protocol, and they're usually adopted by a governance body. And we're going to dive a whole lot more into that and what that means and how to change policy and how to create policy and how to write bills and things of that nature as well, as we dive into this lecture. Next slide.
So what we're going to start off with is really what is the MP's role in national health policy? And so really nurse practitioners are, we're positioned on the front lines of healthcare delivery and healthcare policy issues and development. So we do have a unique perspective when it allows us to really offer that meaningful input at many levels, whether it's national, state, or local levels. Nurse practitioners, we really do play a significant role when it comes to healthcare access. When we discuss healthcare equity, legislation, nursing scope of practice, and community-wise disease response. And I think that we've been able to see this firsthand based on our efforts with the COVID-19 pandemic. We do engage in health policy development at national level work with other healthcare professionals to adopt or change guidelines potentially put forth by the CDC, the FDA, the Centers of Medicare and Medicare Services and Medicaid Services, the US Health Resources and Services Administration. That's just some of the examples of different organizations that we do align with. Some of the other examples of national health policy that we really serve is access to care, quality of care, potentially cost of health care, public health crisis, and different legislative decisions.
So I think Dr. Fedino really hit it on the head in the different areas that we can get involved in, different types of organizations. So nurses and political action means finding these organizations to get involved with, to see things and to exercise influence. A lot of times I will tell new grads or new nurses who want to get involved in this is to look at something that may be bothering you in the system and how you can change that, and getting involved with different organizations to make those things happen. Next slide, please. So when we think about nurses in political action, we're looking at where we can exert our influence. And again, I'm going to go back to Dr. Fedino's first slide where she says that we need to exert power, but sometimes we feel powerless. One of the key themes that I want to keep coming back to, and you're going to hear me say it multiple times in this presentation, is we are the experts. We are the experts in nursing. We have gone to school. We are trained to the highest standards of our degree. We sit through boards. We have a board certification process, and we are the experts in our niche of healthcare. We are also the most trusted professionals in the healthcare organization. So we're the ones that are at the bedside or working with the patients. And those are the key pieces that I think that you need to remember as you think about being involved in politics. We are the most trusted profession and we are the experts. If you take those two key pieces with you when you're trying to create influence on policy, that will really steer you very nicely. We can influence policy by in our workplace, such as things I've talked about, finding things that may make you frustrated. We all have things that are frustrating in the workplace. Are there any kind of community or activities or local boards that you can align yourself with to help some of these changes that you're looking to implement? Again, getting involved in professional organizations, sitting on committees, Nurse Practitioners in Women's Health, American Academy of Nurse Practitioners, AANP, ACOG, different organizations where you can sit on these committees and learn from people who have already been on the ropes and have done a lot of this legislation. And then again, if you're not the type of boots on the ground person, but you're still interested in being involved, that's where you can also get involved in campaigns and letter writing and do things from behind the computer screen, where you still have a lot of influence. Next slide, please. So there are four main steps in the process of public policy formation. And that the first step involves setting an agenda. And that's why it's important to get involved with these local committees and local organizations, because oftentimes they have an agenda, and things that may be frustrating to you are probably frustrating to other individuals as well. And so they already may be on an agenda in certain organizations that you may align with or that you're a member of. And so it's really important to dig into those organizations and see what their initiatives and their goals are. Then look at what the government response has been. How has the response been to something that you're looking to change? Create a design and then an implementation. And that's where getting involved in these local organizations and national ones is really important. Next slide, please. Again, the process, like we talked about, is identifying the problem. Look at other local groups that may have those same concerns and those same issues. Work with them to set an agenda, or if they have one already, ask to see what that looks like and what kind of things they've been doing. And then the next step is getting involved in more of the activism and advocacy. Again, you don't have to be this boots on the ground if that makes you nervous those first couple years, or go with someone who's boots on the ground, talks to the legislators, and just learn from them. There's lots of different boot camps that exist with local organizations where you can get involved and you don't have to do talking, but you could be there as a student or a mentee mentor type of relationship. Then the next step is looking for implementing for the science and the research, and then evaluation. Next slide, please. Timing, again, is going to be very crucial. It's really important when you think about the legislative session that those things start in January, but all of the time that goes ahead of that is the planning phase. So you take the full year to plan to get ready for the January legislative sessions and the key targets you want to hit. So a lot of times legislators and people that you want to talk to in the political sphere get very busy during that legislative time, usually from January to April, May, depending where you live and which states, and if you're going national, local, or just in your own state. And so the time to hit these people up with your questions and concerns and reaching out to them is usually during those fall months, late summer, where you can go in and send emails. They're sometimes more responsive because they're not as busy. Get involved with a group of nurses as well, where they have experience doing this, and just recognizing factors that need change. I'll keep saying that over and over again throughout this lecture, is things that you want to change. I guarantee you other people are in those same lines. Next slide, please. It's really important to really kind of find those visionary leaders. There's leaders doing this in your states and in your national levels. And most nurses, for the most part, are genuinely good, are good humans, good Samaritans. And so if you find a way to reach out to them through email, or if you meet them at a conference, go and talk to them. A lot of times they'll bring you to the ropes, or they'll give you some ideas and suggestions. We are the ideal profession because we're there at the bedside. We hear people's concerns, and we really are in a place of leadership where we can kind of be these visionary people to take on these changes that we're hoping to see. Next slide.
So when we talk about nurse practitioners' role in state health policy, there's multiple levels that we can really affect change. One of the recent changes that nurse practitioners really held a role within state health policy was regarding telehealth practice. And we really helped with that integration during the COVID pandemic when it first started, regarding how do we maintain access for healthcare. So we played a large role within that. We can also directly influence policy related to scope of practice, as well as educational standards within your own state. By understanding training and education in the profession, it does allow policies to aim a little bit more geared towards whatever your state scope of practice is. For example, at the state level, we still have, like with Dr. Quayle, for example, in Georgia, there are certain states where they try to limit the scope of practice. And I think as we all have a general consensus that nurse practitioners go through significant, extensive training and certification and boards, and we should be able to really practice at the full scope of our license. And so having that full practice authority, we can really influence change as well. So those are just some examples. At the state level, we can testify on proposed legislation. Also working with representative regarding healthcare issues that are potentially unique to your state. And so it's being aware of those and then acting upon them. When we discuss local health policy, that really is kind of through your own observations. We have really a unique advantage when it comes to recommending guidelines for community-wide and potentially environmental health issues within your own community. We also play a significant role, like Dr. Quayle had mentioned, on advisory boards. You can sit on an advisory board for potentially your own city planning or city council potentially. we do play a really large role when it comes to advocating for the public and trying to keep our community safe. Essential advocates in healthcare policy. And I think that, nurse practitioners are amazing advocates. And I think part of that as well is our nursing background. And like Dr. Quayle had mentioned, really being at the bedside and advocating for patients at the bedside. And as nurse practitioners, I think that we're phenomenal at playing that advocate role. We have, an amazing background of clinical expertise and educational background to help pass legislation. I think that sometimes we may get, stuck in the weeds as far as thinking, do I really know enough about health policy? We are the ones that when we're going to the legislators, we can't, we are the expert. And I think that we need to always keep that in the back of our mind that these, representatives for our state, they, when we bring an issue to them, we are the ones that know this information and they may not. So just always keeping that in the back of our mind that we can pass legislation and we do have that background. We also, we are on the front lines. And I think that that's important to note that we're on the front lines of healthcare to treat patients with unique needs. We can also relate to personal experiences regarding how potentially legislation can impact our patients. So these are just some key examples of, really how we can be an advocate. Extending on that slide a little bit more, we can also write to state and federal legislators, join organizations that lobby on behalf of patients. Nurse practitioners are members of multiple nursing organizations, and that can really help provide personal testimony. Nurse practitioners are very influential when it comes to writing state and federal legislation regarding how potentially that bill is filed. Like I said before, we can really share on our personal experiences and how potentially bills can, for example, reduce healthcare costs, such as potentially when we look at screenings, for example, or preventative health. Our goal is really to try to either focus on prevention or trying to treat in an earlier disease stage. I would like to just kind of take a moment on this slide though and just pause and really discuss, in preparing for this next legislative session, Dr. Quayle and I will kind of discuss this, but I have a bill that is going to be introduced here in January. And there was several years that kind of led me to that bill. And I promise you that there will be a point within your career that there will be an issue that will keep you up at night that, you aren't going to be able to set aside, that it's just eating at you, that you feel that there's a failure within the system or something that needs to happen. And it will bother you. And I know that for me, that issue, my family is BRCA1 positive, and I've known that since 2013. I've implemented cancer genetics within my own practice, and I order breast MRIs on my patients. Every single patient that is potentially a mutation carrier or who has a high risk for breast cancer, they get those once a year. And I was finding more and more often that my patients were non-compliant. And part of that was due to the cost of their screening breast MRI. And so I would try to order their breast MRIs at the end of the year where they're more likely to have met their deductible, but it was definitely an issue that I was finding more prevalent. And then there definitely came when I was also that patient who needed to have a breast MRI done. And when I went to schedule my breast MRI at a hospital, I was told that, I would have to put 50% down of the cost of my breast MRI before I was allowed to even schedule. And so it was several thousands of dollars. So I decided to go to a different organization where I could get my breast MRI. And I was able to receive that, but I did really feel that financial strain of, that limitation that I needed to get my breast MRI because I was high risk for breast cancer and I was feeling that financial constraint. But my moment, I call it my aha moment, is when I have a patient who is BRCA positive, and she was due for her screening breast MRI, and her husband had recently lost his job. And they did not have the financial means to go in and allow her to, potentially get that breast MRI just because of the cost. And so she came in to see me and we were discussing this. And I said, well, let's just get on the table. Let's do a breast exam and make sure I don't feel anything. And let's kind of get our plan for how can we get you your breast MRI. And when I was performing her breast exam, there was a moment during the exam where my fingers rolled over a large breast mass. And that was the moment that we both paused. And we paused, she looked at me. And at that moment, we both knew that it was too late, that she developed breast cancer. And she did. And she was stage 2. And this was about a year and a half ago when that happened. And she's completed her chemotherapy and her radiation, and she's doing well. But that was my moment where I knew that between several years of practicing, I just could not let this go any longer. And that's when I decided to really focus on implementing this bill in January.
So I always find it very interesting that people come in your life for a reason, and you're going to find that too in politics and anything that you do. And so when I had the pleasure of meeting Dr. Fedino, when I started my trajectory down the road of being on the board for NPWH, I found that we had so many similarities. And every time we speak to each other or tell stories to each other or text each other, it's like, oh my gosh, that's where we align again. And so I find it very fitting when we do this lecture that I also, in a different kind of way, had that aha moment. And it was surrounding, again, a breast cancer type of issue. So I used to work in a breast cancer center with a wonderful breast surgeon, and often he would be in Savannah because that's where he was from, and he commuted back up to the Atlanta area every single week for the practice. And so one of those weeks he was coming up from Savannah and he's in the car, and we have a patient that's at the hospital and she needs to have an MRI done, which he's already filled out all the paperwork and we've put in all the codes and done everything, dotted all our I's and crossed all our T's. Well, guess what? The paperwork's not signed for whatever reason. I don't know, but that's just Murphy's Law for you. It was probably a moment where I was supposed to have that aha. So I went to sign the paperwork. Okay, we'll get it signed. Well, we got a lot of backlash from the hospital. Oh, you're a nurse practitioner. You can't sign. You don't have the authority to sign radiographic images or to order anything of that nature. So for me, that was a very aha moment where I'm a nurse practitioner. I've been practicing at this point for about 16 years. And to the full extent of my practice, I moved here to Georgia. We're a very, very restrictive state, excuse me. And for me, it was like, okay, how do I get involved in policy? How do I start making these changes happen? And I'll be honest, I got involved with an organization called CAPRN, which is the Coalition of Advanced Practice Registered Nurses. It's here in the state of Georgia, and I'm sure multiple states have this type of organization where you can get involved with. And one of the big bills that they were trying to get was a full practice authority bill. Because I'm in the South and in a good old boy network and very, very right-leaning and all about the medical doctor, it's been very difficult. And no, we still don't have full practice authority. But just this past legislative session, we finally have gotten the authority to sign and write for radiographic images, which we are the last state in the entire country. So it was something that started as a thing that was very difficult as a nurse practitioner, even an advanced practice provider, to be able to write for these things to help patients. Something as simple as signing something because they were already in the hospital. And that was for me another aha moment of where, you know what, again, I'm the expert in this field. I'm living boots on the ground, watching this unfold and not being able to advocate for my patient. And that again goes kind of where Dr. Fedino said, is you're going to have that moment in your practice where you're like, okay, something's got to change. And that's again where I kind of go back to that early slides of nurses in caps, but nurses were making a lot of decisions back then, and they probably were in more of a position of power than they thought about. But again, we sometimes don't think of ourselves that way because we're told, oh, you're just nurses. So I just really encourage you to think of yourselves as the experts. Next slide, please. So why do we need to be involved and be politically active? Again, if you look at that at the bright lights at the bottom, is we are change makers. We want to make change happen. Again, you're going to see it in our quotes at the end of the slide, but be that change that you wish to see in the world. Politics are going to change the way, and policies, the way that we do our work. We can represent the interests of our profession, and it's important. It's not okay to just sit there and say, okay, these things aggravate me, or I had an aha moment, but I don't know where to go. If you don't know where to go, you're going to have Rachel, Dr. Fedino's and my emails and addresses at the end of these slides. Reach out to us. And if we don't know, we'll help you. That is the beautiful thing about nurses, is we're supposed to kind of lift each other up, help each other when we may not know where to go to define change, even if we're not in your states. And we are those best advocates for our patients. Next slide. So how do we get involved? You've kind of heard me talk about it throughout. Participate actively in your organizations. You're here at NPWH for our conference. If you're not a member of our organization, I highly encourage you to get involved in our organization. We are starting to do more things around policy. We have written position statements. There are things that we have talked about practice and how to implement it. Simple things about things. I get lots of questions. Can we do men's health as WHNPs? We've written a policy and a position statement on it. If you go back and find that, those are things that you can take back to your boards of nursing when these questions come up, that I see a lot of times on Facebook groups and all these questions. So get involved in your organization. Again, if you're not one of our members, I encourage you to be. Encourage your friends. Encourage your friends to go out and vote. Encourage other nurses. For my faculty that are listening to this, if you are in the schools and you're teaching students, the best way for them to get involved is to listen to lectures and to take a group down to your local capital and to act as their mentor and have a mentor-mentee relationship. And if you're not comfortable, I guarantee there are other faculty members in your schools that are and that are doing this. And then again, it's really important for those maybe who aren't faculty, but your nurse practitioners in the clinical space. Talk to other nurse practitioners in the clinical space. Talk to them about what's concerning. Talk to your neighbors. They don't even have to be medical people. I guarantee you every person has a story about how things have changed them in the medical world, either through themselves personally, a family member, or a friend, and things that are great and things that have been frustrating and they want to see change in. Talk, ask the questions, and then encourage, especially other nurses, to get directly involved. Encourage your neighbors. I've gone down to the Capitol with non-nursing people just because they believed in what we were pushing for. And so there's a lot of strength in numbers. A lot of times these efforts start out as grassroots efforts, and you're leading the charge, but get other people along the lines to get involved with you. Next slide.
So we discussed political competency in nursing. You know, there's three key points I really want to discuss with this, and this can be really at the individual level, this can be at the organizational level, but the three main elements is really deep knowledge, political antenna, and power. And I'm going to break each one of those down. But deep knowledge requires freely sharing expertise and really gaining the knowledge that you need from others. So like Dr. Quill had mentioned before, we really are the subject matter experts. So without knowledge of policy and its process, it's a really doomed strategy. So we really want to make sure that we do our homework essentially on the issue that we're wanting to present. It also involves knowing not only your viewpoint, but also knowing the viewpoints of others. So we want to be able to understand what potentially would be our opposition. And the next step from that is really, how do you neutralize your opposition? So you want to be very knowledgeable on both sides of the spectrum. We go to political antenna. That is really your ability to scan the environment and identify opportunities to offer solutions to the policy problems. So this really does require listening and understanding policymakers' values and motivates them, and potentially compose messages and responses to fit their political objectives. So this also is extremely important when you start working with different legislators and making sure that you're potentially working with the right legislation or committee members. So for example, if you do your homework a little bit and look to see that you want to pass a bill on a certain issue, look to see who within your state or within your district is kind of leading on that committee and reaching out to them, because you want to make sure that you're reaching out to the right committee members and potentially aligning yourself with also who's within your district, and then what are they doing at the state level, and making sure that these are voted officials, and so we want to make sure that they're also representing your own values and healthcare policy issues. When we go to the last competency, that's really power, and Dr. Quayle has touched on this on a couple of points, but really power is the ability to achieve a goal. And the policy process, that's really means recognizing policymakers with power. Like I mentioned before, who's on that congressional committee? Who are the thought leaders in your community? We want to make sure that we're creating these coalitions, essentially, with individuals and groups that have similar viewpoints and similar goals that are important, that align kind of with nurse practitioners' viewpoints, and augment that policymaking power. So when you start to go down the process of potentially taking a bill to the floor, for example, you want to team up with multiple organizations at your state level if it's a state legislative issue. So for example, here in Washington State, I've teamed up with the Washington State Healthcare Hospital Association. I've teamed up with the Medical Association. Since my bill is a breast cancer imaging bill, essentially to try to capture breast cancer earlier by covering screening breast MRIs for this high-risk population, I have teamed up with the Washington State Radiology Association. So besides ACRs, even though they're more at that federal level, or they represent the entire country, they still are very influential with helping me with the bill. Also, if you're, for example, with me, American Cancer Society has made standards regarding my bill. And so also partnering with them is very important, because it does kind of build all of that support. So when you take it to the floor, it kind of does neutralize your opposition, because if you have so much power and you're coming to the floor, it's less likely that bill will be killed.
So Dr. Fedino has talked quite a bit about what that looks like and who and what, and you've heard me say it. So again, I'm just going to kind of reiterate a little bit. We need an action plan. Again, who is that person that's going to influence policy? That is us as nurses. And where is that happening? It can happen at the workplace. It can happen in any environment. It can happen in the schools. And some examples of strategies that you can use as well. We've talked about that throughout. Get involved with media coverage. If you have access to people that'll put you on podcasts or on talk shows or on the radio or things of that nature, that's really important places where you can get the word out. Think about running for office. If this is something that's really inspired you and you've done a lot of work with talking to legislators and you feel like, you know what, I can make change happen, really give a consideration of running for office. I find more and more medical people that are frustrated with the system and they say, I'm going to run for office to see if I can make some change. And when does this happen? It's happening all the time. We are always looking to influence policy. We're always looking at it. And again, our why is for access to care, safety. Again, it really comes down to the patient. It comes down to reducing costs. We know that if we could practice to the full scope of our practice, that we could actually reduce cost of care. Next slide. I think this is just basic 101. I put it out here because I think it's important. I think sometimes when we think about going and talking to legislators on the ropes, it gets a little scary. But again, I'm just going to keep reminding you, you're the expert. You are the person in this field that knows what you're talking about. So again, just 7 communication skills. Be very clear in what you're stating. Be complete, be concise. Again, be very respectful, concrete, and correctness. Use your pleases, your thank yous, your misters, your misses. Decide how they want to be spoken to. Again, maybe remembering gender pronouns depending on what issues and type of people that you're working with and tackling. Do a little bit of information on your legislator that you are going and speaking to or writing to. And if you do get the ability to talk to them on the ropes, I always recommend either a follow-up email, thank you so much, or even a handwritten email to their office address, not an email, a handwritten note. A handwritten note has been lost so much in the times, but it goes a long way. And when someone gets a handwritten note, it speaks a lot of volume because you just don't see that as much anymore. So it may be a key way for them to remember, oh my gosh, Dr. Fedino sent me this beautiful note. I haven't received a handwritten note in forever. So really important things to think about. Next slide. I'm going to again show how research, especially for my faculty out there, when you're able to present the data that you collect, that is key and pivotal. In my trafficking center, since we opened back in 2020 in the middle of COVID, I have been collecting data for over a year and a half on our participants on multiple different pieces of data. And I'm seeing certain things that maybe victims of trafficking are more apt to be runaways, or certain things where it's showing it's becoming very clear in the data. So when I can take that data and present it to the policymaker, again, that shows that we are the expert in the field. I can go to them and say, for example, human trafficking is such a huge problem in this world. It's not getting any better. These are the statistics that I'm seeing at my trafficking center. These are the statistics that we're seeing in the nation. How are we going to change? What are we going to implement in bills to get the people that are the traffickers, as well as even the Johns that come to buy these services? These are some of the things we're working on at the Georgia level. So again, when you're collecting research, especially for my faculty out there, take that research and make a little broad, if you will, or a concise type of statement that you can give to the legislators. This is what I'm seeing in my data. These are the trends, because that's going to hold a lot of water when they can see that it's an actual problem and it's not just something, oh, it's just a problem I'm thinking about, but the data and the research really defends your what you're fighting for. Next slide. This kind of again shows how you're translating your research into policy and how that works and what it does. And again, that's where you go and you tell them it's going to improve healthcare, it's going to improve quality, the value, cost. Those are all the things these legislators want to hear. They need to be good stewards of the state or the local or the national level and what costs look like. And that's always a big thing that's in their heads. So if you can tell them costs and show them the research, that's going to guide you. Next slide.
Dr. Quayle and I discussed that aha moment where something must be done and I need to become involved. And I think that we will all have that moment when old ways of reacting to issues of potentially injustice, inequity, or just powerlessness, it just will no longer work. And it's really when that person or potentially you realize that this issue or this problem is a failure within the system and something has to be done. Like I said, for me, it was, it would keep me up at night, and it's something that I knew I needed to take action. I just couldn't sit back any longer and do nothing. So I think that there's always that defining moment when we have that consciousness raising of that aha moment that is really an adrenaline rush that's going to really push you that, I need to get involved within policy. So as Dr. Quayle had already mentioned, nurses are the highest ranked for honesty and ethical standards, and it's been over 16 years with the Gallup poll. Yet the medical profession remains very a dominant voice and influencer of health policy. And so I do think it's important that, we lean on some of these organizations that are lobbying on the Hill, like AANP and ANA, and, essentially aligning yourself with them and seeing how can we become involved. And also, MPWH, we're writing multiple position statements on our viewpoints, or we're aligning ourselves with different organizations, and it's joining forces essentially, as I kind of mentioned before. AANP does have an advocacy toolkit, and that's really helpful because it can kind of give you all of the pieces when you want to start healthcare policy, from your elevator speech, for example, when you have only just a short moment that you can talk with this legislator and you have it dialed in of what am I going to say? It might just be a few sentences. And so an advocacy toolkit is very essential when you're going through the process of healthcare policy. And we mentioned before, emailing, calling, writing your legislator is so important, but also remembering that that you are the expert. So do not assume that the policymaker or staffer understands the core issues. You have the knowledge on this healthcare issue to really influence the decision. Recently, I testified for expanded carrier screening for Washington State, and they hadn't looked at this and over a decade. They had never addressed providing patients that option and that choice and that right to say that they want to have expanded carrier screening performed before they get pregnant, to potentially make it or have the option to have these additional choices. And so I testified why I felt that was important within our state, that we needed to propose this legislative change. And I was highly influential. There was 3 of us that allowed that to change here in our state. And so, working within the Department of Health as well, there's sometimes just rule changes that may not be a huge legislative bill or an issue, but just even a rule change that they're updating something that we can have that impact. So I think it's so important to take a moment and just move beyond the fear. And this quote is so powerful, but when I dare to be powerful, to use my strength in the service of my vision, then it becomes less and less important whether I'm afraid. And so I think that fear of the unknown and being afraid of, what if I say the wrong thing, or what if I don't know enough? I guarantee that you do. You are in the field, and like I mentioned before, you are going to be the expert. Do your homework, know what you're going in, get your advocacy toolkit ready, get your elevator speech ready, and then it just becomes less that I'm afraid. It turns into, I'm going to make this happen. So also moving beyond the fear is really the first step to conduct political analysis about the issue. So I wanted to kind of go through a little bit of, what is the issue? Is it my issue? Can I solve it? I think that's really important to note. There's different ways to prompt that decision and to take action. When did the issue first occur? Is it a new issue? Is this an old problem? Also look to see, has this been brought to the floor before? Have they tried to pass similar legislation and did it fail? If the bill was killed, for example, try to understand and do your homework as to why was it killed? Was it due to fiscal responsibility? Was it insurance an issue? And then if it was potentially an insurance issue with cost, then start tackling that first, because if we know that the bill has already made it to the floor, then we can start addressing as to what happened, why was it killed, address why was the bill killed, or and essentially to not go further, and then address that, because then we can reintroduce it. There's something that, for example, with a bill that I'm looking for, that I'm putting forth in January. I have aligned myself with the insurance commissioners of Washington State and working with them and actually aligning myself with them and not making them my enemy, but my colleague as well, but looking at how can we reduce that fiscal responsibility. And there's something you can do that's called a sunrise review. So sometimes you can actually bring a bill to the floor, and before the bill potentially could get killed, where the insurance company say, absolutely not, this is too expensive, we're not going to be able to take this additional cost on, just have it taken back for a minute and have it you can do what's called a sunrise review. And that's where then they'll look at that fiscal note, and potentially we can make adjustments to the bill, but potentially keep it alive and push it forward. And another topic is it a real issue? Is it a symptom on a larger one? Do I need to take immediate action? Is this something that can wait? Can it just go away by itself? And can I risk ignoring it? I did put the late Justice Ruth Bader Ginsburg on this slide because I just really wanted to make sure that she was so influential for women's health, really women's rights. And, I highly respect her, and she's such a loss to our nation of just paving the way for us, and everything that she did. And any really quote that I can put up is just so powerful, but I really just putting credit to her just because she was just so influential within within everything that I think we represent with even an organization. So moving beyond the fear to kind of just take a couple more minutes here just to go through this additional slide is, it's not what you say, but how you say it, right? So 20% of communication is really what you say, and 80% of it is how you say it and to whom. So in legislation, we really get into battles and negotiation, and it can get really easily, you can get distracted. So to really be a successful advocate on the issue, you want to make sure that you continue to have that big picture. So don't potentially get too stuck in the weeds with, a heated debate or, what somebody else is saying on the opposition. Always take a step back and look at, okay, my goal is having a larger goal on the matter and getting this passed. So it's identifying what the opposition is saying, trying to neutralize it, but also don't lose sight of the big picture. So it's really critical to frame policy in terms of improving health of patients and the broader healthcare delivery. So trying to keep it fairly broad rather than really singling your focus on the profession. So we're talking about broad healthcare issues. So for me, it's looking at screening breast MRI for the entire state. And what does that mean? And is it a certain population, or does this look at a mandate for people? Do your homework, like I mentioned before. And really, it's important to network and bring relationships and partnerships because we want to look at a long-term strategy. Potentially you'll align yourself with people that there could be a trickle-down effect, but then there's all these other bills that stem from potentially you aligning yourself with some of these policymakers and legislators. And you might start with one bill and you might get 5 other bills out of it, or might stem another conversation. And so this is a long-term strategy. So it's a marathon, it's not a sprint. So we want to make sure that we're also impacting short-term strategies, but I think it's also really important to make sure that this is a long-term strategy.
So you've heard our stories. You've heard Dr. Fedino talk about hers. You've heard me talk about mine. I'm not going to spend a ton of time on this slide going over the stories again, but I want to point out sometimes people that you think may not be your allies, try to make them your allies. They always say, keep your friends close and your enemies closer. And I know I'm not going to use physicians as our enemies because I don't think they are. But I'll be honest that legislators, because they may not have that healthcare experience, and again, we're the experts, they sometimes don't realize maybe that we actually understand what we're talking about. They'll see MD attached to someone's name, and so they think that they may know everything. So oftentimes I'll say, if you can try to align yourself with other healthcare professionals, physician assistants, physical therapists, even our MDs, and you can get them to kind of see your issues and the concerns and how it's a cost for healthcare, how it affects your state. We always say here in Georgia, it affects Georgians. What does that do for them? It affects everyone. It's not just a nurse practitioner issue. Sometimes if you can bring other healthcare people into the arena, we are much stronger as a team than as just a local person trying to fight an uphill battle. I want to take a few minutes where I'll be the legislator and Dr. Fedino is going to be the nurse practitioner with boots on the ground at the ropes, just to kind of give you a little bit of a role play of what this looks like. So we're going to kind of play this out in a little role play for you, just to kind of have you understand. So I'm a legislator. I've now come to the ropes. And hello, Dr. Fedino. Thank you so much for coming and talking to me today. What can I help you with?
Thank you for taking the time to discuss this important issue with breast MRI. I wanted to just take a minute to understand if we can discuss why Washington State has typically one of the highest rates of breast cancer in the country. And so breast cancer is one of the most frequently diagnosed cancer for women within Washington State. And it's really the second leading cause of death. I wanted to put forth this bill regarding screening breast MRI and the fiscal responsibility that I really do believe that we could actually save the state a lot of money if we implemented something similar to that nature of covering breast screening MRIs for patients who are high risk for breast cancer based on a genetic mutation or certain risk factors.
So I'm not a medical professional. So tell me, I know MRIs are really expensive. How is it really going to save the state or help the patient if there's a big cost for that? I always have to be a steward of my state and talk about costs for me.
So when we look at the cost in our state for the average breast MRI is around $1,200. However, when we look at a patient who's been diagnosed with breast cancer, potentially stage 4, because this is a high risk population, they're more likely to develop breast cancer and aggressive breast cancer. It's over $133,000 for a patient, just one patient, if they are diagnosed with advanced breast cancer. And if that patient requires additional services towards the end of life, that's potentially an additional $22,000. So if we look at a $1,200 screening breast MRI for these patients versus potentially close to $200,000 per patient that is diagnosed with cancer and potentially can die, we can save the state a lot of money. When we look overall, it's been estimated that about 26 billion could be saved nationwide from early cancer diagnosis alone. So right now we have one of the highest rates of Ashkenazi Jewish population within our state of Washington, and that's actually in Seattle. And one of 40 patients that has that Ashkenazi Jewish potentially does have a BRCA mutation. And so when we look at our high numbers, and Washington State is very low on screening, we are potentially chasing the needle at this point. If we don't do something, we're going to be costing our state a lot more money due to the fact that these patients will be diagnosed with breast cancer and potentially at a late stage.
Wonderful. Yeah, I didn't think about it that way. Thank you. Thank you for shedding light on this. If you want to give me some more information, here's my business card. My email's on there. You can send me an email to recap everything. Thank you so much.
So Dr. Quayle and let me actually move this along here. Dr. Quayle will take us home.
So again, I'm just going to kind of go over our last minutes of thoughts. All of us should be fighting for full practice authority. If there's an issue and you don't know what it is yet, I'm telling you right now, it's to practice to the full extent of your education and training. Dr. Fedino, fortunately, is able to do that in Washington. I'm not. So reach out to your full practice states. There are many times I will reach out to Dr. Fedino and say, help me here. How did we get this passed? So look to other states that have done it if you have colleagues there. Achieving a high level of education and training and getting, again, your full scope of practice so that you can be that advocate. Partner with physicians, partner with other healthcare professionals, collect your data, make an infrastructure for what would be an effective workforce that is cost effective and savings, and then be part of politics to make a positive change. Next slide.
As Dr. Quayle alluded to earlier, I don't find it any way to end a presentation besides with a very well-known quote, but be the change that you wish to see in the world. And I think that Dr. Quayle and I we both have passions towards certain healthcare policy, and we're trying to affect local change, but also national change. And we want to encourage everybody that's hopefully enjoyed this presentation today, that if there's a healthcare issue that's eating at you inside, that know that we're here to be supportive. Our organization is fantastic with bringing in people and really helping them to let their voices be heard. And so we want to thank you, and I'll have Dr. Quayle end it on her final note, but thank you so much for coming to the conference and listening to our presentation today, and hopefully you were able to take a couple of key points home with you.
I'll reiterate again what Dr. Fedino said. Thank you so much. We're going to stick around after the lecture, and you can talk to us in the chat. We'll give you our emails and how you can reach out to us if there's some things that you've had this aha moment during our lecture. Thank you again so much.
Bye, everybody.
Bye-bye.